This surgical unit has been designed to provide a very safe and regulatory compliant facility that can be used to temporarily replace or augment the capacity of an existing surgical facility, or to provide a mobile ambulatory surgical center that can operate as an independent unit. As a self-contained facility, it also can provide an environment that can duplicate the hospital operating room in a disaster setting. This surgical unit has backup systems for power, heating, ventilating, air conditioning, medical gases, communications, and water. These units have a history of regulatory healthcare compliance and licensure, including Medicare certification in several states. The units located at Stony Brook have a connection to the hospital that uses a corridor and provides a seamless and weatherproof interface. The corridor also provides additional workspace, storage, and scrub stations. This is just one example of the design possibilities for connecting corridors. The mobile surgical facility can also be used in a standalone mode for outreach or disaster reaction deployments. The vestibule can be configured to create a barrier and airlock if the unit is used independently, or the vestibule can be omitted to enlarge the patient care area if a corridor is used to create and maintain a protected environment. The patient care stations have been designed to provide all of the equipment and support functions that are needed for safe and effective preoperative and postoperative patient care. Each patient care station includes oxygen from a fully functional piped medical gas system, suction from a high-capacity dual-pump vacuum system, a nurse's call system including a code blue function, data ports for connecting to the computer network, telephone ports for both voice and fax transmission, power outlets including designated emergency power outlets, auxiliary 12-volt outlets, patient monitors for vital life signs, clock display for the universal clock system, multiple reconfigurable storage compartments, track-mounted privacy curtains, charting surface, restroom. The restroom is equipped with grab bars, a nurse's call station, and can be equipped with either a full-pressure flushing toilet or a low-volume toilet for deployable units. It can also be outfitted with a bedpan washer. The restroom also includes a sink and storage cabinet. The janitor's closet has a floor sink, hot and cold water faucets, mop storage, and storage for cleaning supplies. The loft contains the rack-mounted network computer server with 20 hardwired Ethernet connections and a wireless router and connections to the outside, including the hospital or other facilities' network. It also contains either a business-type telephone system or wired connection to extend the 20-plus phone jacks as extensions of the parent facility. The UPS that backs up the electronics as well as the designated AC outlets throughout the unit are also located in the loft. The nurse's station is the heart of the patient care area and contains monitors and alarms for the medical gas and water systems. It also contains the network server control station, the master clock panel, the nurse's call and code blue system, the video system with an 8-channel DVR, the annunciator panel for an external emergency generator, and the controls for the sound system in the patient care area. The nurse's station also has a double-locking narcotics cabinet, flat-screen monitors, and an infrared-controlled scrub sink. The nurse's station is also the heart of a very robust telemedicine infrastructure, which includes a copper and fiber optic backbone to support advanced data, voice, and video networking. This backbone includes the latest types of wiring with additional circuits to allow for future upgrades in equipment. The patient care stations also allow for installation of future types of interfaces and connectors. The electronic version of a nervous system supports over 20 Ethernet ports, over 20 voice and fax ports, plus 8 video inputs and 8 video outputs. The data, telephone, clock, and video systems are all integrated. The OR is approximately 17 by 22 feet and contains over 360 square feet of space. The same environmental conditions exist as in any OR. The room has positive pressure and multiple filters, including 99.9% HEPA filtration. It also provides for 25 air exchanges per hour. The OR is protected by a system of barriers that protect and control entry into this sterile area. The OR, like the rest of the unit, is equipped with Herman Miller seismic rail that allow for rapid resupply by using either C-lockers or C-frames in many different configurations. The OR can also be equipped with more than one anesthesia station to provide more options for turning the OR table, or for taking care of more than one patient if used in an emergency situation. The Skytron surgical lights are the same as the ones used in any hospital OR, and include such features as video cameras and remote controls. The lighting can be adjusted, and there's a variable control halogen spotlight that's designed especially for the anesthesiologist to use for charting under low light levels in the OR. The OR has a separate sound system that allows for multiple inputs, including iPods. The anesthesia panels have multiple medical gas outlets and additional vacuum connections. The clock display in the OR also allows for count-down or count-up timing functions. The flow of patients is from the patient care area, which is also under positive pressure but not as positive as the OR, into the OR and then back into the recovery area of the patient care area. The flow of the disposable waste is taken from the OR in plastic bags into the forward contaminated storage room, and from there they can be removed from the unit without going back through the OR. The flow for surgical instruments is from the OR to the soiled workroom, where they can be cleaned using ultrasound if needed, and then pass through to the clean side for sterilization and return to the OR. This prevents contamination from splashing from dirty to clean instruments. What we've just shown you is a mobile surgical facility that is safe, regulatory compliant, and reimbursable. This facility provides the same type of environment that your staff and patients have come to expect from a licensed and regulated healthcare facility. This facility can also be rapidly deployed to a different location to respond to a variety of situations, from outreach programs to on-site disaster response.